Good evening, doctors. Welcome again. Today we are going to discuss about clinical MCQs for urology, neet PG for plab 1 or these MCQs for usmle. A 65-year-old man present with painless hematuria. IVU is normal, intravenous urograph. Prostate is mildly enlarged with mild frequency. What is the most appropriate next step? In such condition, we need to go for flexible cystoscopy. Why? Let's discuss. Okay. Painless hematuria in an elderly, here 65 years old man indicates carcinoma bladder for which flexible cystoscopy is done. Okay. For BPH is not advanced to cause hemorrhage. There is mild enlargement of prostate and mild symptoms of prostration, and hemorrhage is unlikely at this initial stage of BPH, which makes bladder cancer as the likely cause of painless hematuria. It is also less likely to prostate cancer as symptoms of prostration are mild indicates disease is not advanced. Moreover, bleeding in cancer prostate is less common. Okay. A 79-year-old anorexic male complains of thirst and fatigue. He has symptoms of frequency, urgency, and terminal dribbling. His urea and creatinine levels is high. His serum calcium is 1.9 and he is anemic. Blood pressure is 165 by 95 mmHg. What is the most probable diagnosis here? So the diagnosis here is carcinoma of prostate because patient 79-year-old age, he is anorexic, yes, fatigue, dribbling urine, calcium level is high. So this is prostate cancer. First to stay in this case, almost all feature goes in favor to prostatic cancer. Frequency, urgency, terminal dribbling, features of prostatism, age, anorexia, and anemia constitutional features of carcinoma prostate. And it would be the accurate presentation if it was hypercalcemia, but given calcium level is a hypocalcemic level and it is the main cause of discrepancy of this question. Renal failure from urethral obstruction in carcinoma prostate is a common presentation. Thrust is a feature of hypercalcemia. Here may be erroneously calcium level is given in hypocalcemic level, probably a bad recall. Prostate biopsy is a confirmatory diagnosis and others like serum PSA is suggestive. There are some suggestions that renal failure may be cause hypocalcemia. Okay. 80-year-old man presented with pain in his lower back and hip. He complains also of waking up at night to go to the washroom and has urgency as well as a dribbling. What is most likely diagnosis here? 80-year man, he's old. Pain in lower back and hip. Yeah, pain in lower back and hip. He also complains of waking up at night, washroom, urgency and well dribbling. This is case of prostate cancer. Yeah. Age, nocturia, urgency, dribbling points towards prostate pathology. Pain of lower back, hip joints towards bony metastasis from prostate cancer. Blood test for PSA, prostate biopsy, and then MRI if initial biopsy negative to decide repeat biopsy. Okay. So hope till here it's clear now. A 75-year-old alcoholic present with mass of umbilicus, urinary dribbling, incontinence, and clots smelling of ammonia. What is the next step in management? Urethral catheter, because alcohol sometimes causes retention of urine, but this is a less common cause of retention. Okay, now a 64-year-old man has been waking up in the middle of night to go to the bathroom. He also had difficulty in initiating micturition and complaints of dribbling. A diagnosis of BPH was made after a transrectal ultrasonography guided biopsy, and the patient was prepared for TURP. What electrolyte abnormality is highly likely due to this surgery? That is hyponatremia. Yeah, hyponatremia, absorption of fluid used for bladder irrigation to flush out blood clots and IV fluids, all may lead to hypervolemia and dilution. Hyponatremia. Okay, now a 65-year-old man presented with frank hematuria. He has no other urinary symptoms. What is most appropriate next step? What will lead to the diagnosis? Go for cystoscopy. Sometimes it is a bladder cancer. Yeah, the key is cystoscopy. Diagnosis is bladder carcinoma. Reason for the diagnosis is frank hematuria and no other urinary symptoms, and age. Hematuria in young 25 to 30. Diagnosis will come acute polycystic kidney disease. Yeah, let's discuss. I already explained like this. See, cystoscopy, then bladder cancer, 65 age, asymptomatic hematuria, and other is ADPKD, very few and no symptoms. Patient after transurethral prosthetic biopsy, the electrolyte imbalance can be developed is hyponatremia. Hyponatremia, use of fluid for bladder irrigation, may lead to dilutional hyponatremia. Okay, now 75-year-old man with adenocarcinoma of the prostate, which has spread outside the capsule of the gland, has ARF. What is the most appropriate next investigation? 75-year male, adenocarcinoma prostate, spread outside capsule gland, ARF, acute renal failure. Appropriate investigation, need to do USGKUB. Yeah, USGKUB extension beyond capsule may cause obstruction of ureters, causing loin pain, anuria, symptoms of acute kidney injury or chronic kidney disease. Here ARF reference patient information. Okay, now a 75-year-old war veteran complains of loss of appetite and says he has lost weight over the past few months. He says that he has passed some blood in his urine. However, he had no pain. A recent report shows that PSA more than 5.5. How will you manage this patient? We need to do in such case loss of appetite, weight loss, past few months, some blood in his urine, he had no pain, PSA more than 5.5. So need to do here radical prostatectomy because he is a case of CA prostate. This is a case. Yeah, let's discuss. Radical prostatectomy is answer controversial through PSA is a bit higher than normal. It is not confirmatory of carcinoma, but loss of appetite, weight loss, highly suggestive of cancer. Age 75. Active surveillance is offered first for low Gleason score, especially at the age of 75, and any other treatment depending on extension of tumor will be offered after exclusion maths. Okay. 75-year-old man comes in complaining of difficulty in passing urine, poor stream and dribbling at the end of voiding and anorexia. US shows ultrasonography shows bilateral hydronephrosis, What cause of these findings? So this is a case of prostatic cancer. Yeah. Prostatic carcinoma, elderly 75-year-old with obstructive symptoms of lower urinary tract, bilateral hydronephrosis, all can occur in BPH or CA prostate. Anorexia is a client here. It is feature of carcinoma rather than BPH. Okay. Now, a young boy has acute scrotal pain for a few hours. Exam 1 testis is very painful to touch. He had this kind of pain before, but it was mild and resolved itself within 30 minutes. What would you do next? In such condition, uh, urgent exploration, because this is a case of torsion of testes. Yeah. Urgent exploration as sudden onset of severe pain, likely diagnosis, torsion of testis, infection takes a more prolonged course. Next step is urgent exploration. Okay. A young man present with sudden severe pain and swelling in his scrotum. Exam 1 testis seems higher than the other. What is the most probable diagnosis? This is a case severe swelling scrotum testis higher than other. This is a case of torsion testis. Yeah, this is a torsion, testicular torsion, sudden severe pain, scrotal swelling, higher position of the affected testis is diagnosis of testicular torsion. You may get further support and from examining premastic reflex which is absent in testicular torsion. Okay. 65-year-old man complains of hematuria, frequency, hystency, and nocturia. He reports that on certain occasions he finds it difficult to control the urge to pass urine. Urine microscopy confirmed the presence of blood but no other features. What is most probable diagnosis? Hematuria, frequency, hesitancy, nocturia. Certain occasions find us to pass urine. Urine microscopy confirm blood clot. So most probable diagnosis here is BPH and prostatitis carcinoma. But there is no constitutional feature of carcinoma. Bleeding more common in BPH and occurs minority in case much less common in prostatic carcinoma. Features given are of prostatism only, which favors the diagnosis of BPH. Okay. Now, a 79-year-old man who is being treated with GnRH antagonist for proven adenocarcinoma of prostate attends a follow-up session. What is the most appropriate investigation here? Go for serum PSA because this is a case of CA prostate. CM-PSA is used to assess the progress of treatment. If a man PSA level rises after prostate cancer treatment, his doctor will consider the number of factors before recommending further treatment. Additional treatment based on a single PSA test is not recommended. Instead, a rising trend in PSA level over time in combination with other findings such as abnormal result or imaging test may lead a man doctor to recommend it for a treatment. Okay. A 61-year-old man, non-smoker, comes for the hospital with complaints of painless hematuria, urgency and dysuria. He has been worried about his loss of weight, reduced general activity. Which investigation would be diagnostic of this condition? So he's a smoker, painless hematuria, urgency and dysuria, loss weight. So diagnostic here is by cystoscopy. Yeah, with biopsy. Painless hematuria in elderly is due to CA bladder. Usually in bladder cancer, there are UTI-like symptoms like urgency, dysuria, also constitutional symptoms like weight loss and reduced general activity is a feature of carcinoma. Okay, now a man present with 3 days scrotal pain, exam thickening of left testes, and it is hard to touch. What is the most appropriate management? That is antibiotics. This is a case of epididymoorchitis. Yeah, scrotal pain of 3 days with thickening of testes, which is hard to touch, suggest epididymoorchitis, which treated with antibiotics. Okay. A man presented with carcinoma of bladder has been working in factories. He wants to know what dye has caused it. What is single most likely cause? That is aniline. Aniline. Okay, bladder cancer it causes. Now, a 25-year-old man attended in urology OPD has single testes. He was investigated and other test was located in the abdomen. Other testes was located in the abdomen. What is the best management plan for this patient? Go for orchidectomy. Yeah. But why orchidectomy? Ectopic test is prone to develop testicular cancer and therefore it should be surgically removed. Okay. A 75-year-old man has urinary symptoms of hesitancy, frequency and nocturia, rectal exam, large hard prostate. What is most appropriate investigation? Go for serum PSA. Urinary symptoms and hard prostate per rectal examination suggest prostatic cancer. For PSA should be done. CA 125 for ovarian cancer, CA 153 for breast carcinoma, CA 199 for pancreatic carcinoma, CA for colorectal carcinoma, PSA for prostatic carcinoma marker. Okay. Now, a 70-year-old man presents with a fluctuant swelling of the scrotum which feels like worms. When he is standing, it regresses. When he lies down, what is most likely the probable diagnosis? This is varicocele. Yeah, varicocele is a fluctuant swelling of the scrotum which feels like a worm, suggestive of varicocele. So guys, I hope till here it's very much clear for you. If you have any queries, any question, you can ask me, and if you still not subscribe my channel, please subscribe it. Thank you. Good day. Goodbye. That's all for today.